When you get a cut or scrape, you probably clean it, slap on some antibiotic ointment, maybe put a bandage on it, and forget about it. For people experiencing homelessness, that same small cut can become a life-threatening infection within days. Robert, a construction worker who lost his housing after a workplace injury, once showed me a scar running down his arm. Started as a tiny scratch from a fence, he explained, tracing the keloid tissue. By day 3, my whole forearm was swollen and red. Thought I was going to lose the arm, maybe my life. He wasn't being dramatic. Studies show that homeless individuals are 4 times more likely to die from treatable infections than housed populations, with sepsis and cellulitis being leading causes of hospitalization. That is thousands of people fighting battles against microscopic invaders without access to the medical weapons most of us take for granted. I spent nearly a year documenting how homeless communities handle medical crises, specifically infections. What I found was a fascinating and often heartbreaking world of street medicine, where knowledge passed between individuals saves lives daily, where desperation breeds innovation, and where the line between folk remedy and actual medicine blurs out of sheer necessity. These folks have become amateur doctors, pharmacists, and nurses rolled into one, treating everything from infected cuts to abscessed teeth with whatever resources they can scavenge or afford. Trust me, after seeing what some people endure and overcome without proper medical care, I'll never complain about my doctor's copay again. The ingenuity isn't just impressive, it's literally keeping people alive when the healthcare system has completely failed them. Let's start with the most basic and crucial step in preventing infections, something that becomes incredibly complicated when you don't have a home. Because cleaning wounds sounds simple until you realize that doing it properly requires resources most homeless people do and have regular access to. Clean water is the foundation of wound care, but as we've discussed, finding it consistently is already a challenge. When you do find water, you need to assess if it's clean enough for medical use. Drinking water and wound cleaning water should be the same thing, ideally, but desperate times call for compromises. The fountain at the library is my go-to for wound cleaning, explained Marcus, a former and now living on the streets. I know the pipes there are relatively new, and the water tastes clean. I've used it on dozens of cuts and scrapes, never had a problem. But that gas station on 5th Street, their water comes out brown sometimes. I wouldn't put that anywhere near an open wound. Soap is the next essential, and most public bathrooms have it, though quality varies wildly. The pink industrial soap is actually pretty good for cleaning wounds, Sarah shared, demonstrating proper wound washing technique in a McDonald's bathroom. It's harsh, smells terrible, and dries out your skin, but it kills bacteria effectively. I've learned to pocket those little hotel soap bars whenever I find them. They're gentler and easier to carry than trying to steal soap dispensers. The washing technique matters as much as the water and soap. You need to actually scrub the wound, not just rinse it. That means causing yourself pain, which requires willpower when you're already hurting. I time myself, at least 30 seconds of active scrubbing, Marcus explained. Count it out loud if I have to, because half-assing wound cleaning today means a serious infection tomorrow. Learned that lesson the hard way more than once. Hydrogen peroxide and rubbing alcohol are the gold standard for disinfection, but they cost money. A bottle of hydrogen peroxide is like $2, which doesn't sound like much until you're choosing between that and food, Jennifer said. When I can afford it, I buy it. When I can't, I make do with thorough soap and water cleaning. Some stores, if you ask nicely and explain you're treating a wound, will give you a small amount in a cup or spare bottle. Antibiotic ointment is another expense that adds up. Those little tubes of Neosporin cost $5 to $8 depending on size. For homeless folks on tight budgets, that's prohibitive. I've learned to ration it, Tom explained, showing me a nearly empty tube he'd had for months. Just the tiniest amount, spread thin over the wound. One tube can last me 6 months if I'm careful. Though I've also learned which free clinics hand out samples. There's a church clinic that gives out single-use packets every Tuesday. Bandages and gauze are surprisingly expensive too. A box of Band-Aids costs for dollars, and when you're changing bandages daily on a wound, you go through them fast. I've used everything as makeshift bandages, Rachel admitted. Clean napkins from fast food places, paper towels, even feminine hygiene pads work great for bigger wounds. They're sterile and super absorbent. You just tape them on with whatever tape you can find. Looks ridiculous but gets the job done. Tape itself becomes a precious commodity. Medical tape is ideal but expensive. Duct tape works in a pinch but hurts like hell when you remove it and can damage healing skin. I found that electrical tape is a good compromise, one man shared. It sticks well, doesn't cost much, and removes easier than duct tape. I keep a roll in my bag specifically for wound care. My friends make fun of me for being prepared, but they're also the ones asking to borrow it when they get hurt. Clean cloth for cleaning wounds is often scarce. You need something that won't leave fibers in the wound, but is also absorbent. T-shirts work if you can spare one, but when you only own two shirts, sacrificing one for bandages is a tough choice. I keep a specific bandana just for medical purposes, Marcus explained. Wash it whenever I can, boil it in hot water if I can find a way to heat water. That bandana has probably saved me from a dozen infections. It's filthy and stained beyond recognition, but it's mine and I know its history. The prevention mindset becomes crucial when treatment resources are limited. Homeless individuals who've been on the streets for a while develop an almost paranoid attention to avoiding injuries. Watch where you sit, don't walk barefoot ever, be careful around sharp objects, one woman listed. Sounds obvious, but when you're tired, hungry, and stressed, you stop being careful. That's when injuries happen. I've trained myself to always be aware of potential hazards. Hypervigilance isn't just for security anymore, it's for health too. But even with the best prevention and immediate care, infections still happen. That's when homeless people turn to the limited medical resources available to them, navigating a complex system that's often hostile to their needs. Because emergency rooms are supposed to treat everyone, but the reality of accessing that care when you're homeless is far more complicated than just walking through the doors. Emergency rooms can't legally turn away anyone with a medical emergency, and a serious infection qualifies. But going to the as a homeless person comes with complications most people never consider. First, there's the wait time, which can be 8 to 12 hours for non-life-threatening conditions. When you have nowhere to sit comfortably, no money for food or water during the wait, and all your belongings are in a backpack, you're paranoid about someone stealing, that's torture, Robert explained. I've left ERS before being seen because I just couldn't handle the wait anymore. The treatment you receive can be excellent or dismissive depending on the staff and how busy they are. Some doctors and nurses are angels, truly caring about homeless patients. Others clearly see you as a nuisance taking up resources, Jennifer said. You can tell by their body language, the way they talk to you versus how they talk to the patient in the next curtain. They treat your infection, but they make sure you know you're not welcome. Follow-up care is the biggest problem with a treatment. They'll give you antibiotics for an infection, maybe enough for 3 days, then tell you to follow up with a primary care physician and finish a full course of antibiotics. When you don't have insurance, a doctor, or money for the full prescription, that follow-up doesn't happen. I've gotten half-treated at ERS more times than I can count, Marcus said frustratingly. They start you on antibiotics but don't give you enough to finish treatment. Then the infection comes back worse, maybe antibiotic resistant, and you're back to square one or worse. The bills are another nightmare. Even though they treat you, the bills come eventually, massive amounts you'll never be able to pay. These bills destroy any chance of rebuilding credit or financial stability. I probably owe $50,000 to various hospitals at this point, Tom estimated. From infections, injuries, other health problems. That debt follows you forever. Collections agencies harass you, it ruins your credit. Sometimes I think about not going to the even when I need to, just to avoid adding to that mountain of debt. Some homeless individuals have figured out how to game the system slightly. Give a fake name and no address and they can't bill you, one man explained, morally gray, sure. But when the choice is between fake identity or dying from sepsis, I'm choosing life. They still treat you and I still feel guilty about it, but not guilty enough to die over billing logistics. Free clinics exist in many cities, but they're often overwhelmed and have limited hours. The free clinic near downtown only operates Tuesday and Thursday afternoons, Sarah explained. If you get infected on Friday, you're waiting almost a week for care, assuming the infection doesn't get too serious in that time. And even then, they can only see about 20 people per day. You need to line up hours early to get a spot. I've slept outside that clinic overnight to ensure I could be seen. Community health centers serve low-income populations on a sliding scale, charging based on ability to pay. For homeless folks with zero income, treatment might be free or very cheap. The community health center has been a lifesaver for me, Rachel shared. They don't judge, they understand my situation, and they work with me on costs. I've had multiple infections treated there. They also connect you with other resources, like mental health services and social workers who can help you find housing. Veterinary antibiotics have become a controversial option for some homeless individuals. You can buy fish antibiotics or bird antibiotics online or at pet stores without a prescription, and they're often the exact same chemical compounds as human antibiotics. I'm not proud of it, but I've used fish antibiotics for infections, Marcus admitted quietly. Fishmox is amoxicillin, the same stuff doctors prescribe. When you're desperate and can't access human medical care, you do what you need to survive. It's risky, dosing is tricky, but it's worked for me multiple times. The veterinary antibiotic route comes with serious risks though. Dosages aren't standardized for human use. You might take too much or too little, quality control isn't guaranteed, and you could have allergic reactions without medical supervision. I've seen people make themselves sicker using fish antibiotics wrong, one woman warned. Someone took way too much, had a bad reaction, ended up in the anyway. If you're going to do it, at least research proper dosing and know the risks. Expired medications are another gray area source. Dumpsters behind pharmacies sometimes contain medications that are past their expiration dates, but still potentially effective. Most medications remain effective well beyond their expiration dates, though potency decreases over time. I found antibiotics in pharmacy dumpsters still in sealed packages, just expired, Jennifer shared. Antibiotics don't become poison after expiration, they just become less effective. If the choice is between expired antibiotics or no antibiotics, I'm taking the expired ones and hoping they still work. Sharing medications happens constantly in homeless communities. Someone gets prescribed more antibiotics than they need. They share with others who have infections. It's technically illegal and medically inadvisable, but it happens out of necessity and compassion. My friend had leftover antibiotics from a dental abscess, gave them to me when my leg got infected, Robert said. Probably saved me from losing the leg or worse. We look out for each other, and that includes sharing medical resources when we can. But when professional medical care isn't accessible and pharmaceutical options aren't available, homeless people turn to remedies that would fit right into a frontier medicine handbook. Because folk medicine and street remedies have kept humans alive for thousands of years before modern antibiotics existed, and that knowledge hasn't disappeared. Honey has legitimate antibacterial properties and has been used for wound treatment for millennia. Medical-grade honey is scientifically proven to fight infections, and even regular honey has some effectiveness. I keep those little honey packets from fast food restaurants for wound care, Sarah explained, showing me a collection of stolen honey packets. Clean the wound with soap and water, dry it completely, then apply honey and cover with a clean bandage. Change it daily. I've seen minor infections clear up using just this method. The sugar content prevents bacteria growth, and honey has natural antibacterial compounds. Garlic is another folk remedy with actual scientific backing. Allicin, the compound that makes garlic smell, has antimicrobial properties. Some homeless folks make garlic paste to apply to infections. Crush raw garlic, apply it directly to the infected area, leave it for 20 to 30 minutes, then wash off, Marcus instructed. Warning though, it burns like fire, but I've seen it reduce swelling and redness in infected wounds. Whether it's actually killing bacteria or just irritating the tissue to increase blood flow and immune response, I don't know. But it seems to help. Tea tree oil is expensive, but highly effective as a topical antiseptic. A small bottle costs about $10, but it lasts forever since you only need drops at a time. Tea tree oil is strong, never use it undiluted, one woman warned. Mix a few drops with water or oil, then apply to infections. I've used it on everything from cuts to skin infections to tooth abscesses. It smells like medicinal Christmas trees, but it works. The homeless clinic actually recommended it to me when I couldn't afford prescription antibiotics. Salt water rinses work for mouth infections and can help clean wounds. Salt draws out moisture, which bacteria need to survive. It's free if you can get salt packets from restaurants, and water is usually findable. I've treated gum infections with salt water rinses multiple times, Tom shared. Swish warm salt water around your mouth several times a day, and within a few days the infection improves. Doesn't work for serious infections, but for minor ones, it's effective and costs nothing. Turmeric paste has anti-inflammatory and antimicrobial properties. You can make a paste from turmeric powder, which is cheap at grocery stores, mixed with a little water. The Indian restaurant downtown sometimes gives me turmeric when I ask, Rachel said. I make a paste and apply it to infected wounds. Turns everything yellow, looks ridiculous, but it seems to reduce inflammation and speed healing. Plus, it's been used in traditional medicine for thousands of years, so there's got to be something to it. Baking soda has mild antibacterial properties and can be used to clean wounds or make a paste for infections. It's cheap, available everywhere, and has multiple uses beyond infection treatment. I keep a small container of baking soda in my bag, Marcus explained. Use it for wounds, use it as toothpaste, use it to neutralize odors, use it for just about everything. Mixed with water, it makes a basic antiseptic wash that's better than nothing. Alcohol from mouthwash can be used to disinfect wounds in a pinch. The alcohol content in most mouthwash is high enough to kill bacteria, though it is not as effective as rubbing alcohol, and includes other ingredients that might not be ideal for wound care. I poured mouthwash directly into wounds when I had no other option, Jennifer admitted. Burns worse than anything I've ever experienced, makes rubbing alcohol feel like a gentle massage. But it's something, and something is better than nothing when you're fighting an infection. Plantain leaves, the weed not the banana, have been used in traditional medicine for wound healing and have some antimicrobial properties. They grow everywhere, even in cities, and can be applied directly to wounds. There's this older homeless guy who taught me about plantain leaves, one man shared. You find them growing in parks, between sidewalk cracks, everywhere. Wash them clean, crush them to release the juices, apply to the wound. I've used them several times. Don't know if they actually helped or if the wounds just healed on their own, but I figure it can't hurt. The placebo effect shouldn't be underestimated either. When you're doing something, anything, to treat an infection, the psychological benefit of taking action can boost your immune system and healing. Half of street medicine is probably placebo, Tom acknowledged. But if believing something will work helps your body fight infection, does it matter? The mind is powerful, and when you have nothing else, hope and belief might be as important as any actual medicine. But folk remedies and street medicine have serious limitations. They can help with minor infections, but are no substitute for antibiotics and proper medical care when infections become serious. That's when homeless individuals face difficult and dangerous decisions. Because knowing when an infection has progressed beyond street medicine capabilities, that's the difference between life and death, and making that call without medical training is terrifying. Warning signs of serious infection include spreading redness, red streaks running from the wound up your arm or leg, fever, chills, confusion, and extreme swelling or pain. If you see red streaks moving up your limb, you need a hospital immediately, Marcus said firmly, the former M training coming through. That's sepsis starting, and sepsis kills fast. I don't care how much you hate hospitals or fear the bills, that's a die without treatment situation. The decision to seek professional help versus continuing self-treatment is complicated by multiple factors. Fear of medical bills, past negative experiences with healthcare providers, distrust of the medical system, and even pride can delay people from getting necessary care. I've waited too long before going to the multiple times, Robert confessed. Kept thinking I could handle it myself, that it would get better, that I didn't want to deal with hospitals. By the time I finally went, infections were much worse than they needed to be. Almost lost my foot once because I was stubborn and scared. Peer pressure to seek help exists in homeless communities. When other people see you declining rapidly from an infection, they'll often push you to get professional care. My friends literally dragged me to the once when I had an infection I was ignoring, Jennifer recalled. I was so out of it with fever I wasn't thinking straight. They probably saved my life. We watch out for each other, and sometimes watching out means forcing someone to accept help they're refusing. The triage system in your own head develops with experience. You learn which infections you can probably handle and which require immediate medical attention. Small cuts, minor skin infections, early-stage abscesses, these I feel confident treating myself, Sarah explained. Deep puncture wounds, anything involving joints or bones, infections with fever, those go straight to the I've learned where my capabilities and professional medicine needs to begin. Dental infections deserve special mention because they're incredibly common among homeless populations and particularly dangerous. Tooth infections can spread to your brain or heart and kill you, but dentists are even less accessible than doctors for homeless individuals. I've had 3 serious tooth infections, Tom said, pointing to gaps in his smile. One I treated with antibiotics from the one I treated with salt water and prayer, and one resulted in me pulling my own tooth with pliers because I couldn't handle the pain anymore and couldn't access a dentist. That last one was probably the worst experience of my life. Abscess draining is another dangerous self-treatment that happens regularly. When abscesses form pockets of pus under the skin, they need to be drained. Properly, this should be done by a doctor in sterile conditions. In reality, homeless people often drain them themselves using whatever sharp instruments they can sterilize. I've lanced more abscesses than I want to admit, Marcus said. Sterilize a knife or needle with flame or alcohol. Puncture the abscess, drain the pus, clean thoroughly. It's risky, you could make things worse or introduce new infection, but sometimes the pressure and pain are so intense you don't have a choice. The community knowledge sharing around infection treatment is extensive. Successful treatments get shared, warnings about ineffective or dangerous approaches circulate quickly. We have an oral tradition of medical knowledge, Rachel explained. What worked, what didn't, what almost killed someone. This information passes between people constantly. It's not scientific or verified, but it's practical knowledge earned through lived experience. Preventive care gets discussed too. Keep your feet dry to prevent fungal infections. Don't share needles ever. Clean any wound immediately, no matter how small. Change your socks regularly if you can. The basics that prevent infections in the first place. An ounce of prevention is worth a pound of cure, especially when cure is hard to access. One woman quoted, "We remind each other of these things constantly because preventing infection is so much easier than treating one." The emotional and psychological toll of dealing with infections without proper medical care affects mental health significantly. The fear that a small cut might kill you, the stress of constantly monitoring wounds for signs of infection, the trauma of having to perform self-treatment that's painful and scary. You never feel safe in your own body, Jennifer said quietly. Every little injury becomes a potential crisis. It's exhausting being your own doctor, especially when you don't know what you're doing and mistakes could be fatal. But despite all these challenges, the inadequate resources, the makeshift treatments, the constant danger, homeless individuals continue to fight infections and survive. The improvisation, the community support, the sheer determination to keep living despite a healthcare system that's abandoned them, all of it demonstrates remarkable resilience. The patchwork of visits, free clinic appointments, veterinary antibiotics, folk remedies, and shared knowledge creates a survival medicine system that operates in the shadows of legitimate healthcare. It's not ideal, it's not safe, and it shouldn't be necessary. But it exists because it has to, because people refuse to give up, because the will to live persists even when the means to survive are scarce. As Robert told me while cleaning a cut on his hand with meticulous care, using techniques learned from dozens of previous infections. Every infection I successfully treat without losing a limb or my life is a small victory against a system that doesn't care if I live or die. It shouldn't be this way, shouldn't require this much knowledge and luck and desperation. But until things change, we'll keep doing what we do, treating ourselves with whatever we can find or afford, teaching each other what works and what doesn't, and surviving one infection at a time against all odds.